You've probably heard all sorts of stories about masturbation, especially when it comes to aging. Some people say it's completely harmless, even beneficial, while others warn that it could weaken your body, damage your heart, or even affect your brain. But how much of that is actually true? If you've ever wondered whether self-pleasure after 65 is safe, you're not alone. Many seniors quietly ask themselves the same question but feel too embarrassed to bring it up. After all, society often makes it seem like sexuality is something that fades away with age, or that it's inappropriate to talk about. But here's the truth. Sexuality doesn't just vanish when you hit a certain number, and pleasure is a natural part of human life, regardless of age. In this video, we're going to set the record straight. We'll separate fact from fiction and get to the truth about what really happens when you masturbate after 65. Can it harm your health? Does it have any benefits? And most importantly, how can you make sure it remains a safe and positive part of your life? Now, before we go any further, let's be clear. This is a judgment-free space. Whether you're someone who enjoys self-pleasure regularly, occasionally, or not at all, this video is about information, not shame. So if you've ever felt guilty, embarrassed, or just plain curious about this topic, you're in the right place. And before we begin, if you haven't subscribed yet, make sure to hit that button and turn on the bell so you never miss an update. We create videos packed with essential insights to help you live a healthier, happier life as you age. Also, we'd love to hear your thoughts. Leave a comment below. Now, let's get into the real question. What's the truth about masturbation after 65? Let's start by tackling some of the biggest myths that have been circulating for decades. You may have heard warnings from well-meaning friends, outdated medical opinions, or even cultural beliefs that paint masturbation as risky, especially as we age. But how much of that is actually based on science, and how much is just misinformation? It's time to separate myth from fact. Myth number 1. Masturbation increases the risk of heart disease. One of the most common fears among seniors is that any kind of sexual activity, whether with a partner or alone, puts too much strain on the heart. The idea is that the increase in heart rate and blood pressure during orgasm could trigger a heart attack or other cardiovascular issues. This concern is especially common among those who have a history of heart disease, high blood pressure, or other cardiac conditions. But here's what the science actually says. For most seniors, masturbation isn't just safe. It can actually benefit heart health. Research has shown that moderate sexual activity, including self-pleasure, can improve circulation, lower stress levels, and even help regulate blood pressure. In fact, studies suggest that engaging in sexual activity a few times a week can reduce the risk of heart disease by promoting overall cardiovascular health. Now, if you already have a serious heart condition, it's always best to consult your doctor about your personal risk factors. But for the vast majority of seniors, masturbation isn't a threat to heart health. It's a natural activity that, when done in moderation, can be part of a healthy lifestyle. Myth number 2. Masturbation weakens the body and drains energy. Another widespread belief is that self-pleasure leaves you feeling depleted, weak, or tired. Some even say it steals vital nutrients from the body, causing fatigue and loss of strength. The truth? This idea comes from outdated beliefs, not science. Masturbation doesn't drain the body. It actually does the opposite. It can help you sleep better, relieve tension, and even boost your mood. That's because orgasm triggers the release of endorphins and oxytocin, two natural chemicals that promote relaxation and well-being. Think of it this way. Engaging in sexual activity, whether alone or with a partner, is a little like exercise. Your heart rate increases temporarily, but afterward, you often feel more relaxed, clear-headed, and even energized. It's not a drain on your body, it's a reset. Now, like anything in life, balance is key. If someone is masturbating excessively to the point where it interferes with daily life, sleep patterns, or personal relationships, then it might be time to reassess. But for most people, self-pleasure is a completely normal part of life that doesn't deplete energy. It can actually help restore it. Myth number 3. Masturbation increases the risk of prostate cancer. This myth has been floating around for years, and it's easy to see why it causes concern. The fear is that frequent ejaculation might overwork the prostate, leading to inflammation or even cancer. But modern research tells a different story. In fact, studies suggest that regular ejaculation may actually lower the risk of prostate cancer. A long-term study published in the journal European Urology found that men who ejaculated more frequently, whether through sex or masturbation, had a lower risk of developing prostate cancer compared to those who did so less often. Why? One theory is that regular ejaculation helps clear out the prostate, preventing the buildup of potentially harmful substances. Think of it like flushing out a system. Keeping things moving can promote better overall health. Now, this doesn't mean that excessive masturbation is the key to preventing prostate cancer, but it does suggest that normal, regular ejaculation isn't something to be afraid of. If anything, it might actually be beneficial. The truth? It's all about balance. When it comes to masturbation after 65, the key takeaway is that it's not the dangerous activity some myths make it out to be. For most people, it's a completely normal and even beneficial part of life. As with anything, balance is important. Too much of anything can be disruptive, but when practiced in moderation, self-pleasure is not only safe but can contribute to both physical and mental well-being. So, what actually happens inside the body when you masturbate? We've covered the myths, but now let's explore the science. How does self-pleasure affect your brain, hormones, circulation, and overall well-being? Understanding this can help you make informed choices about your health and lifestyle. When you engage in sexual activity, whether alone or with a partner, your brain triggers the release of several powerful hormones. These include dopamine, serotonin, and oxytocin, the same chemicals responsible for feelings of happiness, connection, and relaxation. Dopamine, often called the reward hormone, is what gives you that pleasurable, satisfied feeling. It's the same chemical released when you eat your favorite meal, listen to music that moves you, or accomplish something meaningful. That's why masturbation can feel rewarding. It's your brain reinforcing something that feels good. Serotonin, on the other hand, helps regulate mood and promotes a sense of calm. People with low serotonin levels often struggle with anxiety or depression, which is why sexual activity can sometimes help improve emotional well-being. And then there's oxytocin, also known as the love hormone. This chemical plays a major role in bonding and relaxation, which is why you often feel a sense of relief or even emotional warmth after orgasm. It's the same hormone released when hugging a loved one or even petting a dog. To put it simply, masturbation triggers the same feel-good cocktail in your brain that you experience during exercise, laughter, or deep relaxation. It's not just about physical release, it's a chemical process that promotes overall well-being. Many seniors worry about how masturbation affects the heart and blood circulation. The good news? For most healthy adults, sexual activity, including self-pleasure, is not only safe but may actually provide circulatory benefits. Here's how it works. During sexual stimulation, your heart rate increases slightly, just as it does when you go for a brisk walk or climb a flight of stairs. This temporary boost in circulation helps transport oxygen and nutrients throughout the body, keeping your cardiovascular system active. In fact, some studies suggest that moderate sexual activity may support heart health by keeping blood vessels flexible and improving overall circulation. Of course, if you have a pre-existing heart condition, it's always a good idea to check with your doctor, but for most seniors, masturbation does not pose a risk to the heart. The key is to listen to your body. If you ever feel dizzy, short of breath, or experience chest pain, it's important to stop and assess whether there's an underlying issue. But under normal circumstances, masturbation is no more stressful on the heart than mild physical activity. Beyond hormones and circulation, your nervous system also plays a major role in the benefits of self-pleasure. When you masturbate, your parasympathetic nervous system becomes active. This is the part of your nervous system responsible for rest, digestion, and relaxation. Essentially, it helps counteract stress by calming the body and mind. That's why many people find that masturbation helps them sleep better, reduces tension, and even alleviates minor aches and pains. It's a natural stress reliever, similar to meditation or deep breathing exercises. Additionally, some research suggests that sexual activity reduces cortisol levels. Cortisol is the body's primary stress hormone. When cortisol levels remain high for long periods, they can contribute to inflammation, weight gain, and even a weakened immune system. By engaging in activities that promote relaxation, such as self-pleasure, you may be helping your body maintain a healthier hormonal balance. When we look at the science, the truth is clear. Masturbation isn't something to fear or feel guilty about. It's a natural function of the body, just like sleeping, eating, or exercising. It helps regulate hormones, supports circulation, and activates the nervous system's relaxation response. For most seniors in good health, masturbation is not just safe. It can be a simple and effective way to promote physical and emotional well-being. Of course, like anything in life, balance is important. Too much of anything, whether it's eating sweets, watching TV, or even exercising, can have downsides. While masturbation is generally safe and even beneficial for most seniors, there are a few situations where it might require caution. Just like with any other aspect of health, paying attention to your body's signals is essential. Let's go over some key warning signs and special circumstances where self-pleasure might need to be approached with care. Number 1. If you have heart disease or uncontrolled hypertension. For seniors with a history of heart disease, high blood pressure, or other cardiovascular issues, sudden spikes in heart rate could be a potential concern. As we discussed earlier, masturbation temporarily increases circulation and elevates the heart rate, similar to light physical activity. For most healthy individuals, this is completely normal and even beneficial. But for those with severe heart conditions, such as recent heart attacks, angina, or uncontrolled high blood pressure, this temporary increase could pose a risk. Some individuals may experience dizziness, shortness of breath, or chest discomfort during sexual activity, and these are signs that shouldn't be ignored. What you can do: if you have a known heart condition or are unsure about your limits, it's always a good idea to check with your doctor. Many physicians actually encourage mild sexual activity, including masturbation, as long as it's done in a way that doesn't put too much strain on the body. Start slow, pay attention to how you feel, and never ignore any discomfort. Number 2. If it's causing pain or discomfort. Another important consideration is physical discomfort or pain during masturbation. While self-pleasure is supposed to be an enjoyable and relaxing experience, certain medical conditions can make it painful or difficult. For example, conditions like arthritis, carpal tunnel syndrome, or nerve damage can make repetitive motions uncomfortable, especially in the wrists, fingers, or lower back. Seniors with pelvic pain disorders or prostate issues may also experience irritation or discomfort. What you can do: if arthritis or joint pain is an issue, try adjusting positions or using pillows for support to reduce strain on the body. Using a high-quality water-based lubricant can help prevent irritation, especially if there's dryness due to hormonal changes. If nerve pain or sensitivity is a concern, experimenting with gentler techniques may help. If pain persists, don't ignore it. Chronic discomfort during masturbation could indicate an underlying medical issue that might require attention from a doctor or physical therapist. There's no shame in seeking advice. Sexual health is just as important as any other part of your well-being. Number 3. If it becomes compulsive or affects daily life. Like anything in life, too much of a good thing can become a problem if it starts interfering with your normal routine. While masturbation is a healthy and natural activity, there's a difference between normal enjoyment and compulsive behavior. Some signs that masturbation might be becoming excessive include: it's interfering with sleep, daily tasks, or responsibilities. It's leading to feelings of guilt, distress, or loss of control. It's replacing other important activities, like social interactions or hobbies. Compulsive sexual behavior, sometimes called hypersexuality, is rare, but it can happen at any age. In some cases, it's linked to mental health conditions, stress, or even medication side effects. What you can do: if you ever feel like masturbation is starting to impact your mental, emotional, or social well-being, it may be worth discussing with a professional. There's no shame in seeking support. It's about finding a healthy balance that enhances your life rather than disrupting it. At the end of the day, your body will tell you what's working and what isn't. If masturbation feels good, helps you relax, and doesn't interfere with daily life, there's no reason to worry. But if it causes discomfort, stress, or health concerns, making small adjustments can make a big difference. If you want to ensure that masturbation remains a safe, comfortable, and positive part of your life, there are a few simple adjustments you can make. As we age, our bodies change, and so do our needs. But with the right approach, self-pleasure can continue to be an enjoyable and even beneficial experience. Let's go over some expert-backed tips to help you stay comfortable, avoid common issues, and enhance overall well-being. Tip number 1. Stay hydrated and use lubrication. One of the most common changes seniors experience is a decrease in natural moisture levels. This is true for both men and women, and it's primarily due to hormonal shifts. For women, lower estrogen levels can lead to vaginal dryness, while for men, changes in circulation can sometimes cause less natural lubrication. Why it matters? Without enough moisture, friction can lead to irritation, sensitivity, or even small tears in delicate skin. This can cause discomfort and increase the risk of infection. What you can do: drink plenty of water throughout the day. Hydration plays a role in overall tissue health, including sexual health. Use a high-quality water-based lubricant. Water-based lubricants are safe, easy to clean, and compatible with all skin types. Avoid oil-based products if using latex materials. Apply liberally and reapply if needed. There's no harm in using extra lubrication. It enhances comfort and makes the experience smoother. Tip number 2. Choose comfortable positions. As we get older, joint stiffness, arthritis, or back pain can make certain positions uncomfortable. What once felt effortless might now cause strain, so it's important to adjust. Why it matters? The goal is to reduce tension on joints, muscles, and sensitive areas, making the experience more enjoyable rather than painful. What you can do: find positions that offer support. Lying down on a supportive surface, like a bed or recliner, can reduce strain on the back and knees. Use pillows or cushions. A strategically placed pillow can provide better support for the hips, neck, or lower back. Take your time. There's no rush. Engage in self-pleasure at a pace that feels comfortable. Tip number 3. Maintain a healthy lifestyle for better sexual function. Your overall health plays a major role in sexual wellness. A strong heart, good circulation, and balanced hormones all contribute to sensation, arousal, and pleasure. Why it matters? Many seniors experience changes in sensitivity, stamina, or arousal, often due to conditions like diabetes, poor circulation, or stress. But lifestyle adjustments can make a difference. What you can do: stay active. Regular movement, such as walking or stretching, improves blood flow and supports sexual function. Eat a balanced diet. Foods rich in healthy fats, antioxidants, and lean proteins support circulation and hormone balance. Manage stress. High stress levels increase cortisol, which can interfere with libido and relaxation. Activities like meditation, deep breathing, or light exercise can help. Remember, masturbation isn't just about physical pleasure. It's a form of self-care that can support relaxation, sleep, and emotional well-being. By making small adjustments and listening to your body, you can ensure that it remains a safe and positive part of your life. Sexual health is just as important as any other part of your well-being. If you found this video helpful, give it a thumbs up and share your thoughts in the comments. Have you heard any of these myths before? We'd love to hear from you. And don't forget to subscribe and turn on notifications so you never miss an update. We're here to provide you with essential tips and advice to help you live a healthier, happier, and more fulfilling life. Aging isn't about slowing down, it's about embracing every aspect of life, including your sexuality. Stay healthy, stay happy, and we'll see you in the next one.